Good morning. My name is Mike Stansel, and I'm the Executive Director of Daly City Partnership. Daly City Partnership serves a diverse community that has representation in almost every demographic possible. Daly City is one of the most diverse cities in the United States. Recently, we've had the opportunity to serve newcomer communities escaping turmoil in Central America, and most recently from Ukraine and Russia. We offer many safety net services. We provide housing, food, mental health, youth and senior assistance, and programs. So before the pandemic, the partnership would be in a position to help people generally with a service or two. What we've seen during the pandemic and now after the shelter in place was lifted is that many of our community members come to us for one specific crisis. They may need help with rental assistance to stop eviction, or they may be looking for food in our distribution lines. But what we find out is that many of them need multiple services. Many of the people that we serve have children. Many of them are intergenerational families that also have grandparents or elders in their houses, in their communities. So we need to serve them in very many facets. So in a lot of cases, what happens is we serve people with a crises mode or triage mode. But as we develop that relationship, we find out that they also need additional help. We may be able to help them with enrichment programming, after school programming for the children. We may be able to help them with additional resources for the seniors or elders in their families by doing referral calls or setting up assistance at their homes. And then we've also seen a real increase in mental health needs in our community. So we can set them up with time with our therapists and interns. So some of our biggest partners are resource partners: Silicon Valley Food Bank, Jefferson Elementary School District, Jefferson High School District, Daly City Youth Health Center. So we leverage those relationships, number one, to just to support each other and refer referrals. A lot of times the services that nonprofit organizations have are poorly communicated to the communities that we work. But we're also very connected to our community in Daly City and North County. Most of our staff are from Daly City. Most of our staff speak a variety of different languages. We have language capabilities in over 7 different languages in Daly City Partnership. So that allows us to leverage communities, especially communities, and partner with communities that are underserved. Our partners is that we are not competitive with each other. We are very cooperative with each other. Definitely. So Daly City's nickname is the Gateway to the Peninsula. Should be also called the Gateway to San Francisco. So Daly City is a bedroom community for the peninsula and for San Francisco, for people who work in the service industry, many immigrants, many children of immigrants. And Daly City, as I said before, is a very diverse community. We almost represent every single demographic, community, ethnicity, religious group, culture possible is represented on the planet. And I think that that's what's really unique about Daly City Partnership and the community that we serve, is that we have to be collaborative. We need to have good communication with stakeholders in our community to truly understand all the different facets of Daly City. And during the last 16 months, we've distributed nearly $5 million in emergency assistance. This is just an example of a program and the size program that's being scaled post-pandemic. It's critical to making sure that we have a strong, safe, housed community.
One other thing that I forgot to ask was about how everyone is working together, whether it's the orgs that are involved, the NCOC, talk about officials. We're talking about the whole like Daly City / North San Mateo County community. How are folks working together in this community towards systems change?
Yeah, I think that that's a great question and needs to be a top priority as we move the shelter in place into a post-pandemic reality. Many of the programs and services and operational expertise we had before the pandemic simply doesn't. So I think that what we are having great conversations about how to change the dynamic and change how business has been done in the past and make sure that we make those adjustments